In hospitals, in remote villages, in crowded cities, something extraordinary is happening across Africa. A silent revolution, a healing revolution. For decades, access to quality healthcare was one of Africa's greatest challenges. But today, African scientists, engineers, and young innovators are rewriting that story. They're building new tools, new machines, new life-saving technologies, not imported but invented right here. This is how Africa is blowing up in health innovation. In 2017, a young Cameroonian engineer named Arthur Zhang asked a simple question: what happens to heart patients who live far from specialists? To answer it, he built something the world had never seen: the Cardiopad, Africa's first medical tablet, a touch-screen device that allows nurses in remote villages to perform full heart exams. The results are sent instantly to cardiologists hundreds of kilometers away. It was African-made, affordable, accurate, and it changed everything. It brought cardiac care to thousands who had never seen a heart doctor. Adopted in Cameroon, Gabon, Congo, and beyond. Recognized by UNESCO as one of the world's most important medical inventions. This chapter of the African health story begins with one young innovator and the beat of a continent's heart. In parts of rural Africa, the difference between life and death can be a few hours of transport. Roads are rough, hospitals are far, blood expires fast. So Rwanda did something bold, something visionary. They launched the world's first national medical drone delivery system. Zipline drones now fly across Rwanda, delivering blood, vaccines, emergency medication, and lab samples in minutes, not hours. Over 50,000 emergency deliveries, maternal deaths from bleeding reduced by as much as 90% in some regions. The system became a model for Ghana, Nigeria, Côte d'Ivoire. Africa didn't follow the world followed Africa. In Ghana, one startup asked a difficult question. What if millions of people can't reach a clinic? What if the clinic must reach them? Then enter Mpama, an AI-driven pharmaceutical network that connects patients to affordable medicines, verified pharmacies, digital consultations, and home deliveries. Their AI system monitors drug supplies to prevent shortages, a problem that used to cost lives. Today, Mpama operates in 9 African countries, has reduced drug prices by up to 30 to 60%, and helped millions access safe medications. African intelligence healing African communities. South Africa turned vans into fully equipped traveling laboratories. These mobile clinics now test and treat HIV, TB, diabetes, maternal health issues, and childhood diseases. Using portable diagnostic machines, nurses can get results within minutes. These clinics reach over 3 million people every year, reduce rural clinic pressure, and have become one of Africa's most effective public health outreach systems. Sometimes innovation isn't a gadget, it's a decision. If people can't reach care, care must reach the people. Across Africa, millions live without affordable prosthetic limbs. A Nigerian startup decided this must end. They use 3D printing to create lightweight prosthetic arms, customized limbs and mobility devices, all at a fraction of the traditional cost. The impact is huge. Prosthetics that once cost $5,000 now cost under $200. Thousands of amputees have regained their mobility. Africa now leads in affordable 3D medical printing. Technology is giving people back their movement and their dignity. Many assume global innovation comes from familiar places, yet Africa is quietly and boldly reshaping that narrative. They tend to forget something. In Africa, innovation is not just about convenience, it's about survival. It's about hope. It's about rewriting what's possible, from heart monitors to drones that fight death, to AI doctors, to mobile clinics, to 3D printed limbs. Africa is not waiting for the future. Africa is building it. This is how Africa is blowing up, not just in tech, but in saving lives.